targeted pretty much anywhere on the body. There's two areas, the lips and this lid. Those two areas you cannot. And then, you know, what's it doing? Like I mentioned, it's helping rebuild that collagen elastin. Okay, so I really like to talk about the tips and how they're delivered into the skin. So we have what's called a resurfacing. It's going to be just that. So it's a 0.75 millimeter, very shallow, just to the surface of the skin. That's going to be more of like that texture, okay? And then we have the traditional, the Morpheus 8. That's going to go to 4 millimeter to 5 millimeter. So you can go at different depths. And so what the beautiful part about that is, are you going to go to 5 millimeter on your forehead? Absolutely not. That would terrify me. No, you will not do that. So you're going to go at a shallower depth on that forehead. But let's just say you're like, oh my gosh, I got to get rid of this thing that's underneath my chin. It's called a cemental area. You can go at a deeper depth. So we can really target that area, and the pre-jawling that we start to get, we can really target that as well. So you, again, different depths. The prime, and this has 24 small tips to this device. This one is called a prime. It has 12, so half the amount. Why is that? So as we age, we start to get these areas around the mouth, under the eyes, above the eye. This, what we call, I always call this my two sons, you know, muscle that I build over time, you know. So you can get into this area, and it's much smaller. So you can get into those really, really small areas. And then you have body, and you can see the body goes now from 7 millimeters to 8 millimeters. So now you can go deeper. So when you have those pockets of fat, like the stomach or the flanks, inner thighs, outer thighs, arms, right? We talked about arms.